Automatically turns my Instagram photos into adorable photo books.
Think about all those photos you've already posted to your Instagram account. That's a whole collection of chat books waiting to happen. Just connect to your account, review, and order. Holy sweet Meghan Markle, it worked!
Chatbooks. Live your life and let Chatbooks print it, one $10 book at a time.
My name's Arian Lewis, and welcome to Models of the Future Workplace with Silicon Slopes. We are very lucky today to be joined by two out of the three of the co-founders of R0, a super cool company that we're going to be talking about that's helping companies stay safe and get back to work. And if I'm just going to say this right up front, if you want to learn more about that, go to r0.com. Oh, lovely. Eli and Grant are with us. Eli, would you like to introduce yourself, and then Grant?
Absolutely. Thank you for having us today. My name is Eli Harris. I'm actually a California native. I spent most of my last decade in mainland China. I started my career on the foreign service track, did a few Fulbrights in Beijing, hopped over to the private sector, joined DJI, the drone company. 6 years ago, started my first business manufacturing battery packs, and was fortunate and had a very small exit last year.
Okay, my 14-year-old son's a big DJI fan. He has to meet you someday.
Good.
Good. DJI, cool. And China. I'm sure that plays into all of this in some way.
Yeah.
Grant?
That's how I met this guy.
Yeah.
Okay.
So I'm a mechanical engineer by training and by nature. And after school, I went and worked in medical devices and pharmaceutical manufacturing. So started at a big company called Abbott, serendipitously the first instant COVID test that was approved.
That's right.
Yeah. It's kind of come full circle, but
wow.
Then moved to a smaller medical device startup where I got to lead the neurovascular value stream. So we made permanent surgical implantables for different neurovascular applications, and then
that was a lot of words right there.
Yeah,
you can slow that down on camera if you need to.
And then shortly after that, I departed sort of the physical world and the regulated medical industry and jumped into a software startup called iCracked. And at iCracked, I got to lead the product and engineering teams. And that's where I actually met Ben and Eli. So Ben was on my board at iCracked, and Eli, when he was at DJI, we actually conceived of a drone repair program, and it never materialized, but he was one of those people that keep in your back pocket and always try to find a way to work together in the future. So grew iCracked for 6.5 years. We got acquired by Allstate in 2019.
iCracked.
Yeah.
See, that's how I feel about 2020.
Yeah.
Yeah.
But yeah, then fast forward to February of last year, got a call from Ben, and we pulled Eli in and started R0, and the rest is history.
So Ben is in the audience today. He's the man behind the curtain, the co-founder behind the hidden co-founder for today. Okay, this is really interesting. So I love the sort of IoT tech thing, the med tech thing. It's coming together to create this amazing thing, which we're going to talk about in just a moment. I'm Arian Lewis. I'm the co-founder and CEO of Kiln. Kiln is a co-working and office community. We have actually an incredible community of tech startups here in Utah, over 250 companies based in Lehigh, Salt Lake, and Park City coming up here in just about a week. So R0, let's just quickly capture what this is. Tell us in your brief words, what is R0?
Yeah, so R0 is a biosafety company, and we exist to reduce the spread of infectious disease. So we're democratizing access to hospital-grade tools and technologies for infection prevention or disinfection. And we're really modernizing this space that's been dominated by commodity chemical manufacturers. And when we started this business, we kind of took a step back and said, well, what should disinfection look like in 2020 and beyond, and now 2021 and beyond? And to us, it looks like a lot more IoT-connected hardware, a lot more data and data science to derive some actionable insights about what's happening in the space, and then a lot more software to feed those insights back to our customers and automate workflows and the like. But yeah, fundamentally, we have a number of different devices that we can deploy into your space for different use cases to fight the spread of COVID today, and then long term, it's seasonal flu, norovirus, E. coli, any sort of pathogen that's endemic to our customer spaces.
Yeah, I don't want to think about anything else other than COVID-19. Yeah. So let's just put the rest of those back. But let's talk about what you're actually doing in a pretty amazing way, right? Technology, we all feel, I think a lot of us felt when COVID hit, this feeling of helplessness in a way, right? That we didn't have control over the situation was controlling us. And now companies are working to go back to work. They recognize that there are all sorts of reasons why they want to be back at work, whether it be mental health or productivity, or collaboration, or innovation. We are all a bit zoomed out and ready to be together. And yet, we have this unseeable enemy in a way that makes it challenging for us. But technology can actually be a solution. And I think that's really an exciting thing, that no matter what we're facing, there are oftentimes technological solutions that can really help us get over to lessen the barriers of what we're facing. So let's just, I know a little bit about this technology. Uvc Technology, is it okay to call it that, by the way?
Absolutely.
Okay, so Uvc Technology, for a lot of us, was like completely, we didn't think about it. It wasn't in the framework of our thoughts at all prior to COVID. Then COVID hit, and I think a lot of us know a little bit about it. It kills COVID. Right? But it kills other things too, bad things.
Yes.
Right. We don't try to kill good things. But the other thing is that a lot of people have experimented with it in different ways. I know a buddy of mine created like a box that he put his groceries in, then closed the box, and then it killed everything on the groceries, and then he could take it out. But you've created technology for the workplace. So run us through these three technologies and how they're used.
Absolutely. So we took our inspiration for these products from hospitals. And when we started this company, we wanted to look at what type.
White.
Yeah, exactly.
There you go.
Clinical, very nice, clean. But we wanted to look at what companies do infection prevention, or what types of organizations do disinfection particularly well. And since hospitals have existed, they've been essentially a communal gathering place for the sick. So they have to keep the patients safe from each other. They have to keep the frontline workers, the surgeons, the administrative staff, and the nurses, and everybody safe from the patients and the pathogens that they're treating. And so fundamentally, if you look at what hospitals do, they do three things. One, they deal with the hands. So they scrub in, scrub out before and after surgery. They wash their hands after they touch a patient, but fundamentally practice good hand hygiene. That's where this device comes in. So,
ta-da!
Ta-da! Yeah, maybe some After Effects for.
Okay.
So this device right here is actually a touchless hand sanitizer dispenser.
Yeah.
And dispenses CDC recommended or approved hand sanitizer solution. And the premise of it is stop pathogens at the door. And so the idea is you're greeted by one of these when you walk into your space. Anything that you might have picked up on your hands is then eliminated from the hand sanitizer. The other unique thing about this device is it actually has a thermal sensor integrated onto the side to take a temperature, to do temperature screenings from your wrist.
Wow.
And so that's a little bit unique in that, today the state of the art is someone walks up to you with something shaped like a gun and points it at your forehead. Not the greatest customer experience.
Sure. Very interesting. I could see these being very useful in hotels and all sorts of other places where I was just in a hotel recently, and they took the gun out and, checked my temperature. But that's very interesting. So that is a really great stop it at the door prevention tool. All right, on to Mr. Robot here.
So this is ARC. ARC is a hospital grade whole room UVC disinfection device.
Yeah, and sorry, I gave it a male identity. It could be female. It may not identify as either male or female. It's just ARC.
Yeah,
All right.
it's whatever you want it to be.
That's good.
Our first prototype was named Hope for Hope This Works.
Hope.
Yeah.
Yeah. That's great. And it did.
It did.
Well, hopefully it did. Well, this one does, for sure.
Yeah. Yeah. So this is a device that the best-in-breed hospitals use, and they use it during a process called terminal patient room cleaning. And so the idea is when a
That
patient...
sounds very serious.
Yeah, it is. It's not. It's like cleaning at the end of a stay. So, patient comes in, they're sick, they're able to leave the hospital, and the hospital needs to turn over the room really quickly. So they come in and wipe down all the surfaces. Studies have shown for decades that humans are a little bit imperfect, and that about 50% of the surfaces, even in a hospital room with specially trained staff using special chemicals, 50%.
They miss stuff.
Yeah, they miss about 50% of the surfaces. And so what they do is they'll wheel in something that looks similar to this and basically plug it into the wall and set a timer and hit go. And everything that the light touches, it disinfects. And you mentioned...
That was beautiful.
Yeah,
Everything the light touches, it's disinfected.
Yeah, it's maybe Lion King reference.
It's nice.
But, yeah.
So this would be amazing in like a cafeteria or something where you have a high volume number of people using this.
That's correct. And one thing I want to touch on that Grant brought up initially is the connectivity aspect. I think never before has there been a means of actually validating what the custodial crews are doing. You send crews in to wipe, to spray, but you don't actually know what was done.
Got it. It's like, did you clean it? Yep,
correct.
I did.
And with these systems, we have LTE on board, which pushes data automatically, so you actually get real-time reporting on who ran it, which room they were in, what time they ran it, and you can generate those reports, one, to make sure the job was done, validate compliance, as well as show to your stakeholders. Because I think half the battle right now is creating safer spaces. The other half is rebuilding trust and communicating what you're doing and showing your staff, your community, your patrons that you are, in fact, creating safer spaces.
Interesting. Very cool. Okay, so it is a robot in a way. It's telling you what's going on in the room through its sensors.
So
it's disinfecting.
You're giving visibility into this process that was historically invisible.
Got it. All right, last one, and then I want to talk about what you're learning about the future workplace. Tell us about this beautiful lad here, or lassie.
So this is Arc Air. Arc Air is a FDA-approved Class 2 medical device, and it disinfects air. And so it
I think
basically...
this is my favorite.
Oh, you want one?
Yeah, I actually do.
We can send you one after this.
Okay.
But
is that a promise?
yes,
Okay.
it's on camera. We have to now.
Good.
But no, we'd love for you to try it out. But basically what this does is it pulls air in through the bottom, and it runs it through this disinfection chamber that we have inside the device. And so the disinfection chamber has a bunch of UVC bulbs in it, and those UVC bulbs irradiate or apply light to the air that's passing through and kills anything that's in the air before spitting it back out the top of the device.
So, would you mind quickly touching on how that's different from a HEPA filter?
Yeah, so the premise of this device is kill, not capture. So a HEPA filter will physically remove particulates from the air, but this will inactivate or kill anything that comes through it.
Okay, so folks, I have a confession. I've been using this technology to a degree already, and it's amazing because what it does is it takes all those little air molecules, turns them into soldiers, and they go around and they clean all of your surfaces as well as your air, right?
Yep.
And it's a really wonderful technology. We could see these in conference rooms, in offices. This is a great way to just constantly be cleaning and scrubbing your space without you even knowing those little soldiers are around doing their work.
Exactly, and the other point to make here is this is a perfect augmentation to a central HVAC unit, which we're working a lot with schools, for example. A lot of schools don't have the money and can't afford to do a $5 million retrofit on their central HVAC system, but it's not adequate to prevent the spread of COVID or maybe even actively contributing to the spread of COVID. So these are perfect as an augmentation, and they're portable too, so you can really move them around wherever you need them.
Cool. By the way, I think if I ever leave Kiln, I am definitely becoming an infomercial host. I love this because I find it so cool to hear about the detail that's gone into the thinking here. But there's a lot more to your story than just the product. You've built this company totally virtual or remote, right? So just what have you learned about the future workplace through the process of building this product? And what are the main insights that kind of led to your creation of this product and the way that your team has evolved?
Yeah, so I think in the early days, the first couple of employees were largely from our network, and so they were in or around the Bay Area where we actually founded the company.
Bay Area company, guys. Everybody listen up.
Not for long.
Not for long. They're moving to Utah.
Yeah, to Utah, to Salt Lake.
That's right. We should have talked about it at the beginning.
Oh, it's fine.
The best Bay Area companies ultimately move to Utah. Note that, Silicon Valley. Coming back to you.
Yeah. So the company was founded during COVID, and so we really didn't have a choice to have an office to collaborate. So what
When did you form?
April 7th, 2020.
So we are
Wow,
almost
you were
1
right
year
on
old.
it.
Yep.
It was like, okay, COVID's here for 2 weeks. Now let's build this company.
Yeah. Well,
That was fast.
We were really watching the world fall apart and change before our eyes, and
Yeah,
we
we
knew
all
we had
were.
to do something to act quick.
Amazing.
So.
Okay.
But yeah, so building the team remotely has been, it's been interesting. One key insight that's a positive is if you want to solve the hardest problems in the world, you need the best talent in the world, and that best talent in the world doesn't exist all in one place. And so, we get the benefit of picking and choosing from all over the world, really. We have employees all over the United States. We actually have an employee in Helsinki, Finland, of all places. Yeah, and
They're smart cookies over there.
yeah,
They had good preschool.
So that's one of the benefits is we have really, really great people. One of the key insights that's been a challenge is really building that connective tissue within the team. And what you don't get in a Zoom world is the water cooler conversation. It often feels very transactional, where you're back-to-back Zoom meetings. You show up and you get down to business, and only one person could be talking at a time. You can't have those side conversations before a meeting starts, and we've really had to be intentional about building that connection. And I'll give you an example of one of the small things that we've done that's been really effective. But at 9:00 a.m. on every Thursday, the entire team has 30 minutes that we keep sacred for a ritual we call random coffee. And so at the beginning of every week, we assign 2 random people throughout the company to meet with each other during that time. And from 9 to 9:30, the entire company is interacting with someone that they may not have ever interacted with.
Oh, very interesting.
Yeah.
So it's like a speed dating session.
Exactly.
And you're all doing it at that time,
Yep.
but not necessarily all together, just one-on-one.
Yeah, and that makes it so you don't have to coordinate schedules.
That's pretty cool.
And I think one of the nice parts of the remote work environment and those Zoom interactions is you inevitably get visibility into some of the awkwardness of folks' home lives. Maybe their dog jumps on their lap or their kid walks in, and it kind of has allowed us to humanize our colleagues a little more. I think
that's a nice
yeah,
thought.
it's been really nice.
Yeah, it's that's true. We have gotten a little wormhole into people's lives a little bit.
Yeah.
A little bit more intimacy.
So you started on April 7th. Tell me where you guys are at now. What's the size of your company? You've obviously been able to build and push out product very quickly.
We're coming
This
up on
is
our first
complex
birthday.
stuff. Okay, so that's right. You're not even a year old. Holy smokes. Okay, so tell us about what the company's like right now.
Yeah, so today we're about 48 employees. We are 48 employees.
Fast growth.
Yeah, it's been a wild ride, but a lot of fun. It's kind of the journey that as an entrepreneur you kind of dream about. And so incorporated the company April 7th, 2020. Within a week or two, we had raised a $1.6 million seed round. And we just hit the ground running. So ARC was our first product, and we designed, developed, manufactured, and brought it to market in 5 months. And
Wow.
yeah, and then
That's great.
We sold over $1 million before we had a website.
yeah,
Really?
Yeah.
Before you had a website?
Yep.
How'd you do that?
all Eli.
A lot of shaking hands and kissing babies without really shaking and kissing.
We
But,
love
yeah.
that. We like the scrappy entrepreneur. We love that you get out, you hustle. That's fantastic. $1 million, no website, and just hope.
Yeah, and
Right?
yeah. So I think one of the big benefits that we had was a network of investors, of friends, of peers that were very supportive and would make introductions to us or for us to potential customers. And so we had a lot of shots on goal early. And then Eli gives us superpowers. The passion that he exudes when he pitches our product, and the passion that we have for solving this incredibly challenging problem that everybody in the world is facing at this point in time. People were buying the story, they were buying the passion, and they really believed in us. And huge credit and kudos to Eli.
So Eli, where are you at now? Like just very quickly, where are you at? How many product? How much have you pushed out?
Yeah,
what kind of stats can you share?
We're coming up on $10 million in bookings before our first birthday. We're 48 employees strong. We've officially launched 2 products. We're launching a couple more in the next quarter. So we are moving quick, very quick.
Wow, fantastic. And most importantly, moving to Utah.
Yeah.
Yes, the Silicon Slopes story continues. Okay, so let's cap this off with some discussion about what are you seeing, what are the insights you're seeing in terms of how companies are going to get back to work. Are we looking at a world where, what percentage of people do you think are going to continue remote? How are the companies that you're working with approaching that equation of getting back to work?
Yeah, I think that there's some really interesting things that we're seeing, and I think the only thing we know for sure is that things have changed, and they will change forever. I think that one of the predominant issues that the partners of ours are facing is there's a lot of lingering psychological scar tissue in the eyes and the minds of their employees.
You notice he has a lot of medical terminology, and this is good. This is good. So a lot of psychological scar tissue is built up.
Yeah,
I feel that, by the way.
Yeah. Everyone, I think everybody is a little anxious to some extent, some more than others. And I think that there's a responsibility and an obligation of employers now to not only create spaces where people can physically be safer, but also feel safer as well.
Yeah, so breaking up that scar tissue.
I think fundamentally the world's going to have a new posture around biosafety. We often draw a parallel to 9/11, how there's certain events throughout history that create everlasting societal and infrastructural changes. After 9/11, you have the Department of Homeland Security. You have TSA with 20,000 employees. You still can't take a water bottle or wear shoes through the airport. You go to a ball game and you walk through a metal detector. These are all just new standards around security that the world upholds, and we did not regress. And I think fundamentally something similar is going to happen with how we regard human health and the standards that we are going to require all employers and shared spaces to uphold in the respect they have for the health and safety of their patrons.
So you're actually saying employers right now should think about what the long term is going to look like. And one of the things you're saying is that the psychological impact is going to have a long-term impact on the way that we just interact with space to a degree.
Yeah, and
Sure.
I think that COVID has really shown us how vulnerable we are. And one of the observations that we've had is, pathogens have evolved, but
That was your last medical term, by the way.
Which one?
You just used your last medical term. Just keep going.
So pathogens have evolved, but the tools that we use to fight them have not. And and it's time for change. And coming out of COVID,
none of us thought about fighting pathogens. It wasn't even in our consciousness.
Right.
We just weren't thinking about that.
But the crazy thing is 40 million Americans get the flu every year, and somehow we've just accepted that that's normal.
Sure.
We think we can do better.
Yeah.
And all cleaning disinfection historically has been time-based. It actually has nothing to do with risk. You clean a space every night, every week, every set interval of time, as opposed to the actual risk in the space. So I think there's a big opportunity.
I feel like most of us cleaned for the appearance of cleanliness rather than for the spread of a pathogen. Look, now I'm using the word. Okay.
See, it's contagious.
It's contagious. Oh my gosh. All right.
But I think there's a big opportunity to get smarter about where, when, and how we clean and disinfect, and be able to prove that actually happened. In order to do that, you can actually objectively look at risk in a space and validate the reduction.
So, I'm just playing this out. In theory, an employee could get a text message in the morning that says, your office was sterilized at 5:53 this morning.
Yep. So imagine waking up
Wow.
to
That's cool.
a daily report that shows you everything that happened the night before. Imagine walking into your space, getting greeted by the hand sanitizer dispenser. You know, everyone's getting a temperature screening when they walk in the door, and then on the bathroom there's an LCD that says last disinfected at this point in time. Maybe there's a dashboard up in your space that shows you what's happening, how many hands were disinfected, and how many air products are, how much cubic feet of air have been cleaned in that space in real time.
Amazing. Okay, last question. You've been a remote company. What are you going to do next?
Yeah,
This
so
we're going to Disneyland, by the way.
yeah.
But what are you going to do next?
I thought about it, but
Yeah.
so our office will be like Disneyland though, with all these different devices.
Oh, it looks so fun.
Yeah, it's going to be a blast. Come by anytime. So we're going to operate a remote first, in-office second culture.
Interesting. Can you just describe what that means to the folks listening?
Yeah, so we're not forcing any employees to move to the office. We have great people that have families and roots in other places, and so we want to keep them. We've also proven through the pandemic that we can work effectively and productively in a remote environment as well. But what that means is we will have sort of a critical mass of people here in Salt Lake City in the office, but everything we do in the office, every meeting we have, for example, we'll have a Zoom conference call, so people can dial in. We'll have a kind of a hot wall on the office, on one of the walls in the office that has a 24/7 webcam that's on, so somebody remote can tap in and say
Into the
"Hey,
office.
Eli," yeah,
Cool.
exactly, and we can kind of interact in real time. But
What platform will you use to connect that?
we're taking bidders right now, but Zoom is our current platform of choice.
Did it again. Good. All right.
Yeah. So it's really building the environment where we can get together and collaborate in person if we want, bring people in periodically and whatnot, but not have that be a requirement, so that we as a company can maintain flexibility on where we hire and how, but also still build that connective tissue and facilitate those interactions. That are so
Sounds like
meaningful.
you've got a strategy, which I think is one of the big points right now. If you don't have a strategy, you should have a strategy, and at least you know that your strategy will probably evolve. But it sounds like you've got a good idea of what your path forward looks like.
Time will tell whether it's good or not. But
Yeah.
to your point, we'll always be iterating, changing, collecting feedback from the employees, and figuring out what works best for us.
Awesome.
And our goal is 0 sick days.
0 sick days. There's a pun there, isn't there? I love that. R0, 0 sick days. Let's just understand this last thing, Eli. You're obviously, super into the detail. What do you think is the biggest insight that you've gleaned this last year? You've built R0 in less than a year. You guys are on a rocket ship. You're growing super fast. What is it that you take away from this experience?
Yeah, I'm stealing this from one of our partners and our CTO, Neil Day. But one thing he said is, if we have the right people and we give them context and latitude, that is a recipe for success. So getting the best talent you can and giving them the right context to be empowered and give them autonomy and latitude to execute on their own, I think that's been extremely powerful for us. So making sure we have that right cadence for information sharing and trusting our employees and our colleagues to realize their own potential.
Wow, awesome. First of all, I'm really excited that this company is building its new home in Utah. And it's clear to me that this is one of the most exciting stories come out of COVID. A technology company, an IoT company, software company to a degree, right? A data company that's enabling the safe return to the workspace, breaking up the scar tissue of COVID, and giving us some hope through technology. So this has been a great conversation. Thank you very much again, Eli and Grant, and r0.com. Again, I'm Arian Lewis from kiln.co, and we very much appreciate our host today, Silicon Slopes, and this conversation on models for the future workplace.